Live.
Namaste. On behalf of the Fogsi Gyan Pravah episode 236, I welcome our President, Dr. Sunita Tandulwadkar, to this podcast. And I also welcome the guest of today, Dr. Padmini Prasad, who will be talking about sex and sexuality, the changing perspectives. At the outset, Dr. Sunita Tandulwadkar has been the brain behind this Gyan Pravah podcast, which has been running very successfully from the tenure she started in January. Madam has very good projects in her bag, and which she has made all of us implement, which all focus towards women's health, improving them, and seeing that we have a healthy society with healthy women. To name a few, the Know Your Number, the Gyan Pravah, the Do Ke Zindagi Ke, and the Eagle Project for the young gynecologists. And Madam has not left behind public awareness and also having dialogues with our own Foxians through the Anubandh program. And she has the public awareness programs of Abarichita and Sampurna, which are running very successfully. And Madam, we congratulate you and we thank you for giving us this opportunity. I am not introducing Dr. Sunita, Madam, formally. All of us know that she is.
Please don't, Bharti.
Yes.
So today is your day with Padmini ji.
Yes, Madam. So I request Dr. Sunita, Madam, to kindly give her opening remarks.
Thank you. Thank you, Dr. Bharti, and welcome, Dr. Padmini, Madam. Thank you for taking out your time and coming on a Foxy platform. Bharti, thank you for choosing such a wonderful faculty who will speak on the topic which is rarely spoken so openly. And it's a need of the time. So whoever are going to listen to this podcast, it will be of a great value. Bharti, you are one of my very dedicated chairperson. I have observed you very closely when you were your state president, the work, the way you do, fantastic. You have a very bright future otherwise also.
Thank you.
And you are doing huge work on cervical cancer prevention. And I appreciate that. Our Do Ke Zindagi Ke is one of that project. And I've seen your passion for this cervical cancer prevention. So keep on doing till we make a Bharat cervical cancer Mukta
Bharat. Yes, thank you. Yes. Thank you very much for your kind words and wishes. And thank you very much for sharing the platform with us. So now I would like to welcome all our delegates to this very important podcast on decoding female sexuality, medical and social perspective. And to discuss on this very important topic, we have our very eminent Dr. Padmini Prasad, who is an OBGYN consultant in the city of Bangalore. Madam is right now the chairperson of the Family Planning Association of India. She has been the past president of BSCOG, and she has received many awards during her tenure as the BSCOG president. And she has started a foundation called Bharavase, that means hope. And Madam is the founder president of Bharavase Charitable Foundation, where she conducts various awareness programs to reach the unreached and speak the unspoken. And Dr. Padmini Prasad is a very familiar personality in Karnataka as well as all over India, especially because she was one of the first woman sexologist from Karnataka who took up this unspoken but very important topic to be spoken in not behind doors but in drawing rooms. So she came out with the discussions which were in the Doordarshan as well as the other favorite TV channels, where Madam's sessions used to start around 9:30 and go on till 10:30, 11. And we were all ardently listening. Though we were gynecologists ourselves, we did not have the courage to speak so openly to our own patients. But Madam gave us that courage. She gave us the knowledge so that we could also question and speak to those couples who come to us with various disorders of sex and sexuality. She is the vice president of the Council of Sex Education and Parenthood International Association 2023 to 25. Madam has been the secretary of the CESPI 2020 to 23. She's a committee member of the Sexuality Education International Society for Sexual Medicine, and she's a member of the World Association of Sexual Health. She has received numerous awards because of her work in creating public awareness. To name a few, she has got the Golden Lamp Award from CSEPI, Lifetime Achievement Award from Vijay Karnataka, that's a very huge newspaper group in Karnataka, and the Economic Times and the Times of India have honored her with awards. She has authored 11 books mainly on sexual and reproductive health, both in Kannada and English. And of course, as I already mentioned, Madam is regularly featured in television and radio channels, and her favorite subjects are sexual and reproductive health awareness programs through various strata of our society. And of course, Madam has also been a faculty in various national and international conferences, and she has also been the chairperson of the Kasoga Sexual Medicine Committee, and she's received an award for that. And she's been a member of the FOGSI Sexual Medicine Committee too. So without wasting much time, I
Thank you, Bharti.
Thank you, madam.
Thank you. And enjoy your podcast, Padminiji. I'll be joining the viewers link now.
Yes, thank you very much, madam.
Thank you.
Thanks for your.
So now, once again, I welcome you, Dr. Padmini Prasad, and it is indeed a very honor for me to be here today, and we will be speaking on some topics which are very rarely addressed. So as we have put across the topic, we are going to decode the medical as well as the social issues of sex and sexuality. To set the ball rolling, I would just ask you a very simple question. What is sex and sexuality? Are they the same, or is there something different?
Thank you very much, Dr. Bharti, for giving such a wonderful introduction of me. I feel really honored, and I thank FOGSI for giving me this wonderful opportunity in this podcast. And we are discussing a very important topic, as you said, which is less spoken and always looked at or listened to with very uncomfortable feeling and with all the anxiety and what will be there, what is there. It's always like that. Anything talked about sex will create this mixture of emotions. And to begin with your question, what is sex and sexuality? Because many people think sex and sexuality are same. Sex is a biological thing, as you all know, can be a male, female, or a transgender. And it can also indicate a physical act of intercourse, and which is a very small portion. That is about, I can say, just on 3% of overall sexuality of any individual. Sexuality is a broader term, and which is a most integral part of every individual, right from the birth till death. And at the time of birth, with a sex assignment being done as a male or female, depending on the external genitalia or an intersex, and depending on the development. And throughout then after that, throughout the childhood, adolescence, puberty, marriage, pregnancy, childbirth, couple relationship, sexual relationship, menopause, and after that. So these are all different dimensions of sexuality. So sexuality is part of the individual throughout life. That one has to understand. And to tell you, the sex or the sexual relationship is for procreation, recreation, and relationship. The nature intends that there has to be continuation of progeny. And without sex, you can imagine the whole life would come to standstill and the world will not continue. So that is the importance of sex and sexuality.
Thank you, madam. You have very well put across what is the biological sex, and sexuality is a complete spectrum of feelings and intimacy and relationships, and it is a very important, pertinent part of life of every single individual belonging to whichever age or whichever strata. So I would just like to hear from you that how has this transformed, because we know that I think in the ages long ago, sex in certain religions was not spoken about, whereas we had our own Hindu religion where sex was given, was placed on a higher mantle, I would say. And we could see even when we go to temples or any of our heritage sites, sex was not hidden behind doors. It was very openly displayed on the walls of all the temples. So, how do you think this sexuality has transformed from ages to what it is today?
See, earlier in olden days, sex was never looked at as an obscene thing
Yes.
or unspoken thing or a taboo thing. It was just a part of life. So that's why, see, even we can feel proud that the Kama Sutra was introduced to the world by our own India and our own
Yes.
Vatsayana's
Yes.
Kama
I
Sutra.
know.
In 4th century itself, the Vatsayana had described everything about the sex and relationship. Many think that the Kama Sutra is just one book which can depict the sexual pictures and talks about sex and look that at with some obscenity or pornographic literature. But in reality, it is a treatise of a big art of love and relationship. So whatever he had written in those days, and he had observed very strict celibacy and puja and meditation when he was writing that book. And whatever that he had written those days has been proved by the modern day sexologists through the human experiments and other studies and researches. So he had very well depicted the female sexuality. Everything, he had given a lot of importance to female sexuality. So during over a period of time, when the man started the experimenting on various things, he also started experimenting on sex. So that because of that and war invasion, Victoria's strict principles, Manu's principles, all those things we created a lot of problem for the sex and sexuality. So that for continuation of life, you need the nutrition and the diet and nutrition. So those things did not become taboo, that whatever that related to continuation of progeny or the continuation of life was something, it was hidden. And because of the various war invaders and changes in the society, and where women and children were abused and sex was misused and abused, and there was violence, and because of all these things, slowly the knowledge about sex was suppressed. But again, now we have come back to that, where people have become comfortable talking about that. We have to thank the media. That brought the things closer to the people also. But and you are also describing that we have got our own Mithuna Shilpas, where temples we have got all these depictions. But there also you can see how natural it was a part of life. And those days the temples were the learning places, centers of learning, where everything people used to gather there and learn everything. And so it was like that. It must have been a natural sexuality education for people also. But at the same time, the whatever that is there, sex and other things which disturbs your mind, you have to leave it outside when you are going towards the God or inside the sanctum sanctorum. And that is how everything was given: dharma, artha, kama, moksha. Towards moksha, when you are going, everything has got equal importance. That's what it depicts, I can say.
Yes, madam, you have very wonderfully put it across, because those days there was no vulgarity associated, because sex was not just procreation, as you said, but also a relationship which is
Yes,
of utmost human values. But
yes,
somewhere down the line, the patriarchal society and the stigmas associated led to a lot of sexual abuse.
yes,
And it was then, I think, that sex and sexuality fell into disrepute, or children were taught in their
yeah,
younger age group that it is a taboo word, or you should not be spoken about. Though, as you said, it is a very normal physiology which has to occur in every person's body, just like our digestive system and our respiratory system. It
yeah.
is a very important
As you
part.
said, that a few years ago, anything talked about sex was thought to be obscene, unparliamentary, or vulgar. So
Yes.
what we have to see is that we have to attach dignity to the subject and look at it in a respectful manner. So what we are looking at is healthy sexuality, healthy sexual relationship, healthy sexual feelings, and everyone has got a right to enjoy the pleasurable sexual experiences without any coercion or violence or by force. So this is a right to have a pleasurable sexual experience without any problem. So that is what we have to look at it as a, to attach dignity to the topic and also look at it in a respectful manner. So that message has to go to
Yeah,
the public.
so Dr. Padmini, to take this to a respectable level and to have an open discussion, I think awareness is something that is very, very important.
Hmm.
So, how do you think that, I mean, especially we have adolescents,
Hmm.
adolescents who are confused, they have access to a lot of information, some of it is right and some of it is wrong, and finally they are in a confused state. And as you said, because of the aspect of thinking of it as just pornography or trying to utilize sex for unwanted reasons or for unwanted pleasures, not the natural way that it should occur, I think awareness is the key to set up these standards where sex is looked up to and sexuality is also on the right path. So, how do we think we could go about this?
Yes, so the knowledge you are talking about the adolescent. Before that, let us talk right from the birth. When
Yes,
they reach up to the adolescence, how you have to create a positive attitude, not a negative attitude about sex. So when you the first, let us give the chance for the
right.
woman to be born. So
Yes,
avoid
right.
that. Don't give the death sentence in utero. We say sex selective
Yeah.
abortions and that the things. So let us allow the woman to be born so that we don't know what she can become a great person or whatever contribution to the society. So that mentality, that gender equality, it has to start from the gender equality without any gender bias. So let her be born and welcome her as a proper welcome guest or
Yes.
welcome part of your family. So that is one thing. So during the childhood also, when the child is exploring its own body, right from the head, the eyes, ears, hands, and mouth, everything. So we snub the because parents snub the child whenever it touches the genitals.
True.
That is also part of exploration of its body. It's a natural process. So because when you are snubbing and then scolding the child and hitting the child, then the child starts thinking, oh, this is a thing which I should not speak, I should not touch.
There's
And so
something wrong
negative
about it.
attitude starts from there only. Just as a matter of fact, when you are giving birth to the child and telling stories to the child, putting her in your lap, and give a positive thing. So you have to cover certain portions of your body. It is delicate, it may get hurt. And if something happens to it, please come and tell me. So baby, children also learn it as a matter of fact thing about their own body. That is the awareness. And also at the same time, you are also from that age, in its own understanding level, you are also teaching about sexual abuse. Now, don't allow anybody to touch your covered parts of the body which are covered with clothes. And if something happens, if someone misuses and touches you in an uncomfortable way, please come and tell. So this is slowly you are giving. And at the
Yes.
same time, when there are both girls and boys in the house, you are also creating the mutual love, affection, and helping each other and understanding and without any abusing the other's body. So both boys and girls are seen equally and brought up equally, so that from that age only they start respecting each other. So future also they will develop with those values in life. So when they reach the adolescent, before they reach the puberty, at that point of time, whenever the parent sees some body changes and the child is entering from it is a bridge between the childhood and the adulthood. That is the time of reproductive maturity and biologically sexual maturity, the emerging sexuality and reproductive maturity. Compared to all other systems in the body, the
Yes.
reproductive system starts developing during adolescence.
Adolescents.
That is the time you have those sex organ developments and then hormones and all those things. All doctors know about it. So during that time, before the children enter the puberty, and when you are observing the body changes, prepare the child for the pubertal changes, physical, mental, emotional, sexual changes. So when they learn these things, there won't be any anxiety or then uncomfortable feeling and so many different thoughts, body image problems, and getting into high risk sexual behaviors, all that and sexual abuse. These things can be avoided when you are preparing the child. Let the child understand the body. Let the child understand about consent. Let the child know that somebody is abusing her body, and she should not get into the high risk behavior because of the attraction, heterosexual attraction or homosexual attraction, which develops during that period only. So that is the time. And at the same time, the self concepts also develop. The self body image, self esteem, and self confidence, all those things. So you should not spoil the self confidence of the girl, and they are teasing the girl and because of the physical changes and all that. So let her learn to love her body and create the self esteem for her, so that so many of this body image problem can be avoided. So they get into all sorts of psychological disturbances, psychiatric problems, all this, because it's not only the physical change, we are looking at emotional and sexual change. So this is all age appropriate, value based, culture appropriate sexuality education is nothing but making the child understand the body, take proper decision about the body, and prevent the abuse, and get prepared for the future changes in the body. So these are all the things which we can look into and then give proper advice. And for gynecologist, anytime when a girl comes with a mother during the adolescent age group, tell the mother, teach the mother how to tell her, or teach the girl, and whatever that happens from a medical point of view. So that is the time you are giving awareness. So that first visit, when she comes along with the mother, or for any other reason, menstrual disturbance or body problems, growth problems, any of these things. And nowadays there's so many problems about PCOD and other
Yes.
things, and they develop lot of because of the low self-esteem and also the body image problems. From that time only they start developing negative attitude towards sex and the body. So that is very important. So, in slowly, when they reach the marriageable age, that is the time you can get into that premarital counseling. So, when they reach the degree or finish that during adolescence, so you should teach them that what is their priority: education, hobby, and taking a job, standing on their feet. And sex, this marriage will be there, and sex can wait. And don't get into this unnecessary high risk sexual behavior, premarital sexual behavior, and the consequences you describe. So, unwanted pregnancies and abortions, physical, mental problems, and sexually transmitted infections. So, how they can control sexual urges at that time? Because that is one thing, you cannot avoid sexual feelings in the mind. Sexual feelings will come, attraction will be there, but they should be taught how they can control it, how they can divert that energy and concentrate on something else. So, with proper awareness and counseling, definitely the children can be prepared, and so many evils in the society can be prevented.
Thank you, Dr. Padmini. As you rightly said, the proper education and awareness and the self-esteem about one's own body should start very early in life, as you said, just from infancy also.
Yes.
And in the same context, yes, we are talking about creating awareness among the society. What about the awareness to be created for our healthcare system itself? Because as we all know, today most of us do go for awareness programs, and most of the time we are only speaking about the biological functions like menstruation or reproductive health, and we keep a very small time frame for discussing anything about sexuality. And even when we go to schools and colleges, there's a lot of stigma associated with talking about sexuality when we go even to colleges. Because as you said, college girls are going to step into marital relationships, and it's very, very important that they know about what is sexuality, what is sex, and what is preconceptional care, and the list goes on like that. So I think we as healthcare personnel are also not very much aware about how do we tackle these issues, or how can we answer the questions to those who come to us with a lot of hope in their mind.
so many times you will be wondering, they will be knowing more than you.
Exactly.
The questions they ask, you will be surprised. All possible questions they ask. I have done so many educative programs for this adolescent, and you ask them to write in a sheet and send it to you, and you will be really surprised the questions they ask. They ask about everything about the female sexuality, attraction, and
Masturbation, what is semen,
lesbianism, and then
what is
marriage,
wet dreams. They ask us what is wet dreams.
everything.
And this is
Everything.
coming from high school children. They
Yes.
ask these questions in high school also.
Because of their exposure to social media. See, nothing is hidden. If they
Yes.
go to internet and social media, everything is there. But what they need is proper guidance.
Guidance.
What they know, whether it is right or wrong. What information they are getting through the media, the internet, because they are getting, most of the time they are getting exposed to pornographic literature. So that is only a stimulative thing, and that leads to sexual stimulation, urges, and experimentation, and all sort of problem. But if they really know how much they can see, what is right, what is wrong, and whatever that is shown in the as pornographic literature or whatever it is, that is not the reality in life, and that is entire life is entirely different, and that is only exaggerated projection, and they should not become addicted to that. So if we give in schools and colleges proper, as I told you, age appropriate, culture appropriate, value based sexuality education, so many of these things they avoid looking at it. So if you think that is something is bad in that, you avoid looking at it or reading that. So that is how you develop a control on yourself, and how you can control and how you can avoid these things. So this is how, because they are getting information. What
Yes.
information they're getting is distorted information. That is unhealthy sexuality education, I can say. So to avoid that, we professionals should give proper we have to visit, or in they use the social media, use the media, and then write ups and all that. Give a proper scientific and medical information, so that let it reach to the students and the public, whether they are in school or outside school or to the public. Everyone needs a proper knowledge about this, because many people still do not know what is right, what is wrong. For that, first the medical people have to step in, because earlier they were all going, lots of myths and misconceptions have come up because of this. Because of these myths and misconceptions, they were only going to the fake doctors, self-proclaimed sexologists, who used to practice in dark rooms like that. So because of that, they were capitalizing on the myths and misconceptions of the public. That can be avoided when the professionals gain knowledge about this. Because of this taboo topic, uncomfortable feeling, and they think it is a very time consuming, and you cannot handle these things, and it is not taught in the medical colleges also.
Yes, very
It is
true.
undergraduate or postgraduate. So they can, abroad, of course, we have the post-graduation, undergraduation, and the teaching. Everything is there. So that has to develop. First, we have to have the courses in our medical colleges only. Then we can start. First, we should come out of that uncomfortable feeling.
Yes.
And we have to know what is the, because of this lack of proper usage of words, the vocabulary. And what people talk is so many times a sexual slangs, and that you should be able to understand what for they are telling. So one boy came and told, I have got pain in my kidneys. But what he was meaning was he was having pain in his
Yes.
testicles.
Testicles.
So that is how it happens. And the woman comes and tells, I have got backache, white discharge. What she is telling is about something about sexual matter. So you have to understand, that's why the healthcare providers must gain knowledge first, and then have a proper knowledge, and make it a habit to ask about this any sexual problem. Make it a part of sexual history of anything, because any disease, operation, medical condition, psychiatric problem, and medication, anything can affect the sexual life. And this is what they suffer silently. They will not come out. They will not tell. They think you may ridicule them. So people think that doctors may ridicule or laugh at them if they tell their problems as far as the sexuality is concerned. So that is how we should leave our uncomfortable feeling, know the facts properly, and create awareness among public or children or whoever it is.
Excellent, Dr. Padmini. As you said, the doctors have to first come out of inhibition. And second, don't be judgmental when somebody comes and asks you. Be open to discussion and tell them the facts exactly in good medical terms. As you said, not to use the slang and medical terminology, and even diagrammatically, you can show them. You can show them video clippings, and you can explain to them in your, if not in your busy outpatient, you can always call them back for another personalized consultation. And I think we need to spend time, because very often a lot of some vague disorders, they keep on coming back to the hospital with some vague complaints, but the root cause would be some marital disharmony due to sexual relationships. The moment they know that you're a consultant who speaks openly about sexuality, they open up with all their problems rather than just talking about white discharge or a backache. And I think it's a responsibility of each and every consultant, whatsoever specialty, especially and more so a gynecologist, because we have more access to their personal life, to their procreation, reproduction. These are all somehow linked to sexuality. So I think this is something, it has been an eye opener to all Foxians to incorporate sexual history not only in your infertile patients or those who come for fertility issues, but I think every other individual, when they come to us, we can always ask them, just like we ask them their medical history, social history, ask them about their sexual history. And very often you get a lot of questions. They become very proactive and they pour out a lot of questions to us.
Correct. And first, we should see that the subject of sexual health or sexual medicine also comes into the teaching.
Yes.
And there should be an examination for that. Is whatever subject which has no examination, then students also don't read.
Yes.
So it should be a compulsory, because it is not a straightforward, simple thing. It includes all that physical, psychological, social factors, and neurological, endocrine, and vascular problems, and all the culture, family, everything is acting. It is a complex interplay of all these factors. So all the subjects encroach on that, because you may have the hormones problem, you may have the surgical problem, you may have medical problems, or you may have the social cultural aspects, relationship problem. Everything is acting on the sexual sex and the sexuality. So that is how it should be a part of all the specialities. Make a part of it, part of the subject in all specialities should be a sexual medicine subject, so that they can understand. We can help our patients better. And we can give a holistic treatment and a better treatment, because sex and sexuality is about quality of life. So that's also important. You are telling we were not talking about sex and many. So the beginning of the Viagra and also beginning of AIDS, invention of AIDS and also invention of Viagra, that gave a wake up call to the society. So because of AIDS, people started talking about the condoms and the safe sex and other things. Later, when the Viagra was introduced to the market as a Ramabana for male sexual dysfunction, erectile dysfunction. So this talk about sex came from the outside the four walls of bedroom, where it was all sexual conversations were limited to four walls of the bedroom. So now it came out, and people also have slowly becoming aware that there has been treatment, there has been help at the end of the road, and doctors also can help them. So that's how it is very important, I can see.
As you rightly said, very often sex was not even a discussion within the behind doors. Also, it was just an act of procreation.
Yes.
That was the place given for sexuality in many, many homes, I would say. And as you said, complex, not only medical problems, it causes a lot of social issues also. So taking this forward, we know that though in spite of creating awareness, now we know that how we could create awareness, but because of lack of awareness, the dysfunctions, sexual dysfunctions are very rarely diagnosed or managed properly. So what are the most common sexual dysfunctions we could come across in women, which could cause medical as well as social issues for them?
Correct. So before understanding what is dysfunction, we should understand what is a normal function. So the sexual response cycle, what we describe, is a sequence of events that happens in the body due to sexual excitation, whether it can be just a sexual fantasy or a masturbation or intercourse. So there will be some genital changes, there will be some non-genital changes also, or general changes. General changes in the form of increased pulse rate, blood pressure, and your emotions, sweating. So generally, body also shows some changes. And in a similar way, the genitals, become prepared for a proper intercourse. And the main purpose of the intercourse, as the sexual intercourse, is nothing but the procreation, helping the procreation, continuing the progeny, and so that the life has to continue on earth. So that is the thing. So that is the basic purpose. Though, of course, I told you it is also for recreation and relation. It immunity booster and gives a cardiac health, and also general stress buster, and prevent certain cancers like prostate cancer and other things, relieves backache and pelvic congestion. So these are all additional advantages of proper sexual relationship. So when these events, a series of events, a sexual response cycle occurs, so there is first a desire to have intercourse, or the libido. So desire to participate in sexual activity, or to have the stimulate, or to have a response for your own fantasy or the masturbation. So that is a desire to participate in the sexual activity. So then whenever after the desire, then there has to be an arousal. The genitalia have to get prepared for the pinovaginal intercourse. So for that reason, in the female, I am talking mostly about female, so that I explain that. So genital swelling lubrication response, we say. So there will be increased blood flow into the pelvis, into the genitals. It becomes congested, and the area becomes the wider, and relaxation of the pelvic muscles. All these things, nature is taking care of everything. They, even without understanding anything,
Yes.
people are experiencing things, whether it is menstruation or pregnancy or the childbirth or the sexual relationship. There is no need to understand what it is. So nature is doing all that, but you have to understand what is happening in your body and what is there. That is the awareness or the knowledge that you have to create. So when the genitals are well prepared and with the increased vaginal discharge, which acts as a natural lubrication for the penile insertion, so then with the erect penis, in the similar way, erect penis is equivalent to the arousal in the female. So that is how whenever there is an intromission, penovaginal intromission, at the height of sexual excitation, there will be an orgasm or the climax, whatever we call it. So desire, arousal, intromission, and orgasm. So these are the different stages of sexual intercourse. So in this technique, or in these stages, there can be disturbance in any of the stages. There can be a desire problem, sexual desire disorders. There can be sexual arousal disorders. There can be problem with the penetration or the pain during penetration, or it can be a problem at the level of orgasm. So later, after the orgasm, all the changes which have happened in the body, there will be resolution phase. So in any of these things, things can take a different turn. What has happened earlier, the woman was not aware of anything. So that woman knowledge also wasn't there. All the time, just before marriage, everything was suppressed knowledge. And suddenly after after the marriage, she is expected to perform the sexual act. And without. So that's how so many girls were ignorant, less knowledge, or absolutely no knowledge, and fear, anxiety, and so many of these things. They were only, whatever advice they were getting is, whatever your husband says, you do it. That is all what they used to have. But nowadays, the ladies, they have got education, they are getting educated, they are becoming aware of the things, and with the availability of contraception, employment, and knowledge, and the woman has become thinking and feeling individuals. And she has developed a lot of expectation. She wants to enjoy everything, and similarly, she wants to enjoy her sexual life also. So because of that, because she is becoming a questioning individual, why I don't have a desire, why I don't have an orgasm, why I am not able to reach the climax. And for that also, so many times what is happening, because of her knowledge and the questioning, and the man is not keeping pace with her. So because of her unrealistic expectations sometimes, and over expectations, and so many pressure on the man, that is also creating a lot of problem for the couples and for the man. So man is developing all problems of male sexual dysfunctions are also coming up. So a desire problem can be there. or there can be arousal problem due to various reasons. Any of these, in general, so there can be organic problems or non-organic problems. So these non-organic problems can be the cultural problems, physical, psychological, mental, day-to-day stresses and lack of time, privacy, and all these, even the simple things, lack of privacy. Lack of, if you don't like your husband, if you have quarreled with your husband, you don't like to have a good time with a husband, so you don't want to respond or cooperate with. So simple things. And now for ladies, the work-life balance has to happen. Morning till night, she will be working and tired, exhausted with the housework, and she does not have desire to have intercourse also. So that is also creating problem. So some developmental problems can be there sometimes, tight hymen and other things. So which can cause some painful intercourse, that also be seen. And arousal also, local infections and then problems, and also some infections, diabetes and other diseases, urinary problem, there can be arousal problems also. And orgasm. See, many have got very different expectations. So they think everyone now, because they discuss with other ladies and they say, we enjoy so much, we have 10 times intercourse also, and someone will say 20 times. So this will create unnecessary problem in the mind of the lady when she listens to all sorts of. Now it is mind-blowing, earth-shattering experience and all that. So all that people, when they talk, it is only unrealistic thing that they are talking, and what they are talking, half of it is not true. So the orgasm for a woman, it is not necessarily all the time a climax feeling. For some women, just a participation in the sex and being close to the husband, just an intimacy, and being having the contact and the closeness and the privacy, that itself she enjoys. See, enjoyment for a woman is very different. Orgasm is not necessary always for an enjoyable and a pleasurable sexual experience. So it depends on your attitude, your knowledge, and how your relationship with the husband. So intimacy relationship also will be very important. And for the orgasm, there can be really some women, some 10% of women are really anorgasmic, where any type of stimulation, they are not able to reach the orgasm. Because the orgasm is nothing but what at the gradually the sexual tension or the neuromuscular tension is built up in your body. So at a height of stimulation, there is a sudden release of vasocongestion and neuromuscular tension in the body. So that will lead to some contractions in the pelvic floor muscles and a feeling of happiness and the forgetfulness and some floating sensation, all that whatever they describe. So that is there. So it is not necessary that all the encounters they will be able to have orgasm. Sometime it can be very good, sometime it may not be so good. But the main problem sometimes what happens, most of the men do not know how to take the wife to the orgasmic level and how to have the foreplay, because the men get arousal very fast and erection very fast, and they may hurry up for penetration where the woman is still not yet ready and without lubrication. She has no arousal yet. So that's why it may cause pain also to her. And once the ejaculation is over, men will not like to continue with any of the stimulation. And so woman feels that she is left in the half. And because the congestion is not relieved, and she may get lower backache and the lower abdomen pain and all that frustration, sometimes anger and all that quarrel, everything can happen. But once they understand how they can stimulate her body, she needs foreplay. Foreplay is for the woman, not for the man. So with the foreplay, body stimulation, and different parts of the body, whatever there should be good communication between each other, what they like, what they don't like. And the biggest organ for arousal and the happiness is the clitoris. So that's why they say clitoris. The literacy about knowledge about clitoris. So once they have, it is the highest supplied organ, the nerve endings which are there. Earlier they used to say it was 8,000 nerve endings. Now they have thought that it is 14,000 nerve ending. So very sensitive part of her body is clitoris. So stimulation of clitoris will give her arousal very fast, and also she will be able to reach orgasm. So the body stimulation, clitoris stimulation, and with that taking her to a higher level of arousal can lead to the orgasm. So men have to understand that. And even after that, once the ejaculation is over, stay with the woman for some more time, give her little more time and help her to reach the orgasm. Then also she can have that. And so the woman has to understand that it is not that all 100% of times you will be able to have orgasm. So even if you are able to have for 50% of the time the orgasm, still we say it is. And if you are unable to have orgasm at any reason for at least for 6 months, and it is causing distress to the man and also to the woman, then that becomes a disorder. Any disorder, persistent or recurrent problem in desire, arousal, or orgasm, and also when it is there persistently for at least 6 months, according to DSM-5 classification. So that's how it is described as a disorder. And anything or everything has got the treatment. Now, treatment also
Yes.
is available.
Solutions are there.
Yes, but why should you treat this whenever there is a problem? Why because the woman, it can cause low self-esteem, frustration, anxiety, depression, thinking that she is not giving happiness to the husband. It can lead to infertility. That is also most of the time you can detect these problems when they come
Yes.
for infertility treatment or when they come for menopausal treatment. Very high incidence during nearing perimenopause and post-menopause. So it can lead to frustration, quarrel, and it can go up to divorce also.
Yes.
So these are all why you should treat because of these things. And to give happiness and overall quality of life to the woman, this becomes very important.
Yes. Dr. Padmini, you have so well put across the whole knowledge about what is normal sexual function and what is dysfunction. And as you rightly said, sex is not just about intercourse. It is not just about orgasm. It is more about sexuality and a relationship, and intimate partner relationships count more than just the act of intercourse or an orgasm, I would say. And then, as you just
Sex is not equivalent to intercourse.
exactly, sex
Sex
is
has
not just
a
intercourse.
very larger the
Yes, because
dimension.
unfortunately, most couples think that if it is sex, it means just having intercourse, even if the
Yeah.
man wouldn't even have seen the woman's face, or he wouldn't even have spoken
Yeah.
a few loving words to her, or wouldn't even wait for her to unclothe herself and be comfortable.
Yeah.
It's just an act of in and out. I think this is where the men also have to be, this is a societal problem where we need to talk to the boys or adolescent boys as well as college or premaritally and post-married preconceptionally. I think we have to
Yes,
speak
you
to
have
them.
rightly said that premarital counseling is
Counseling.
extremely important.
Yes,
Those who
very
are
much.
getting married, instead of thinking only about the chowdhury,
Yes,
dowry,
and the money and the
the
income they are
food and
getting.
the gifts and other things, think about the boy and the girl
Yes,
who are getting married. Let them have knowledge. What
because
is
yeah,
I have watched so many girls. Why are you getting married? What is marriage?
uh,
Nobody could give me a
good
proper. They
relationships.
just
They
do not
never.
know what is the importance of marriage, what is the importance of husband-wife
Yes,
relationship, what problems they can face, what a first night real. So when we talk about myths and misconceptions, so all these things, how the misconception about the first night, first sexual intercourse, and how the myths have
yeah,
come up, virginity myth and vagina hymen myth.
yes.
So these are all we can discuss that in premenstrual counseling itself.
True. Yeah. Because
So
very often we see that the young girls would not even have realized that they are married. I mean, they've just married, and even before they've realized what is sex and sexuality, they're already pregnant. And then pregnancy, postpartum, again, there's a lot of sexual dysfunction and marital disharmony, and there's an increased rate of marital discord and separations. I think premarital sexual counseling itself, I think we all need to introduce it somewhere during this where as in FOGSI, we have the Sampurna program where we talk about a Swastha Nari. So if we have a Swastha Nari has to be there, I think she needs, the couple needs a premarital sexual counseling. I think we all need to include this in somewhere in our clinical practice. I think it should be the day is reached that we need to do that, I think. So
correct.
as you spoke, Dr. Padmini, you told me that about perimenopausal sexual dysfunctions are more. So many women or I mean, men, of course, are more proactive when it comes to sexuality, but women think once they were done with 2 children or their menopause, that's the end of their sexual life. So I think, how is it possible for us to, because they don't even want to come out and speak to us. When we put a question to them, how's your sexual life, or do you have any problem during sex? No, 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 doctor, there's nothing. Don't talk about all those things to us. So I think this also has to be addressed. We're speaking about adolescents, we're speaking about younger boys and girls, but I think we need to educate these midlife women also about sexuality.
Correct. What you said is very much true,
Yeah.
because they think menopause is end of sexual life.
Yeah.
So this is only that the reproductive capability has ended. So because the nature takes care that with the reproductive, to avoid reproductive mortality and morbidity for the aging population, there has been the end for the
Cessation,
reproductive function.
menstruation.
So it doesn't mean that it is end of sexual life also. So because nowadays with the increased lifespan and with the advancement in the medical and scientific field, women are living for longer years. Their lifespan has been increased. Even in the 80s, 90s, they are living up to
Yes.
100 years also. So when the lifespan has increased, they are spending at least one third of their lifetime in the postmenopausal period. So what they need is quality of life. So that is the time when children have grown up and gone out and
They're alone. They're
yes,
there only with their partner.
correct. Only two are there. So they have to look at their quality of life. And the sexual, at that time, they may develop some amount of sexual dysfunction, maybe difficulty in the intercourse, and the presence of other diseases also may come into picture: diabetes, blood pressure, joint pain, or some psychiatric depressions and menopausal symptoms. So some of these things are urinary problem or infections, whatever it is. So because of that, they also may have additional influence on their sexual relationship, whatever it is, but the desire will not die.
Yes.
Desire can be there as long as they
It
are
is suppressed.
alive. Sexual relationship also can continue as long as they are alive. Because so many people come and ask me, till what age we can have
Yes.
sexual relationship? I tell them, as long as you are alive, if you have interest in that. So it's sex doesn't mean it is only about, as you were telling. They think only intercourse and penovaginal intercourse, erection, penetration, ejaculation is intercourse. That is not. Say it is overall sexual relationship is beyond that. They can still have that the body stimulation. They can spend good time together with hugging, kissing, or just a mutual masturbation,
Yes.
mutual stimulation, and whatever comfortable position they can adopt. And then it can be that we can teach them the different position, either sitting, side positions, or standing, or whatever that suits them without causing pain or hurt feeling. So we have to remove that. No, if both of them are not really not interested and they say,
Yeah.
no, doctor, we are both of us are happy. We don't have to force them. No, no,
Yes.
no, you should have intercourse. Why did you not have intercourse? There is no need to tell them like that. So if they complain about it, you have to treat it. You have to detect, diagnose, treat, evaluate, and give them comfortable feeling, whatever they ask for, because the husbands will have desire for a longer period.
Very true. Very
And they
true.
come and complain, my wife does not cooperate. She thinks now it is all over. We have children, grandchildren. Why do you worry about these things? And
And
so
it leads
many
to
a
a lot
place.
of marital disharmony and separations and all that in that age also,
Yeah,
of
and
late we are seeing.
even children also think their intimacy and their togetherness and sexuality is important. Children most of the time they don't think, and they all the whatever one room or two rooms are there, they occupy,
Yeah.
and parents are made to sleep in the
Live
hall,
outside.
no privacy and nothing. So slowly that desire also dies down. Or the daughter may take the father, and son may
Yes.
take the mother for their help or
Personal.
anything like that, and the long separation. So that is why the sexuality of the youngsters is always glorified, whatever, wherever it is, whether it
Yeah.
be, and so that is how it is. But the sexuality of the old age people, this is always ridiculed with so much of shyness and uncomfortable feeling, thinking that we may laugh at them,
Exactly.
uh, we may look at them in a different way. So with so much of hesitation, they enter your and they ask, and I have got this problem, and can we have something? So at this the time they may develop dyspareunia and problem with some infections and these vaginal, changes because of the estrogen deficiency and other thing, genital thinning of the vagina, lack of lubrication, lack of arousal, and they causing pain, and all these things can be helped.
Yes.
Can give her a quality of life. And look at you talk to the couple whatever they want, and whether the man has got some problem or the woman has got some problem, and how best we can treat them. Many things are available.
Yes.
Starting from simple lubricants, moisturizers, hormone therapy, local hormone or systemic hormone, depending on the need. And also the other things, FDA approved drugs, certain things, female Viagra, bremelanotide. Those who are really interested, you help them.
Yes, I think
That is how you can. And nowadays, the modern things, if you are going now, artificial
yes,
intelligence and
yes,
virtual reality, and so many things are now available to because sometimes they may lose the partner, they are
true.
they are
Yes,
alone, and what about their sexuality, about the single woman and the
yes,
interest to help the intimacy relationship. Now that also virtual things are all there, all
yes.
artificial
There are a lot of
intelligence.
sex toys and
So they are all coming up in a big way to
yeah,
help
and I think
people.
we as healthcare professionals should not be judgmental about them.
No,
I think
no,
we have to be very
definitely not.
open and give them a personalized care. Be open to
Yes,
whatever questions and provide them if we have the knowledge. If we don't have the knowledge, we should get them the support from elsewhere, from whoever is like Dr. Padmini. We should be able
yes.
to.
You dissociate yourself from
Yes,
your own sexual morals or sexual things,
exactly.
what you think. Because what you think is right or wrong may be very different for
Yeah,
the patient.
very
So
true.
listen to the patient. What she wants, we are going to help. We
Yes.
are not imposing our morals on them.
Mm.
There. Give them privacy. Give them, be sympathetic, empathetic, and non-judgmental. And whatever problems they have come for, you treat them. Take it as a matter of fact for any other, like how you treat fever, cough, cold, or
True,
any
true.
other
Mm.
disease.
Yeah,
You just say.
yeah.
For gynecologists, other things you have to know is a proper counseling before you take for doing any operation, pelvic
Yes.
surgery, hysterectomy, or the cancer surgery, cancer treatment. So make it a point to talk to the couple.
What
Not
is life going to be after that?
yes, what will happen and
Sexual
what is
life.
because so many times I have seen some men going for extramarital relationship and
True.
another marriage once the
Yes.
hysterectomy has been done to them. Why like that? And they say, no, my uterus is gone, so I am no more a woman. So my husband says I'll marry someone else. I said yes. So there's such an ignorance and innocence is there, and we are partly responsible for that.
Yes,
If
I
you
think
don't
we are
give them
definitely
proper
yes.
counseling.
Counseling is not done.
Yes, proper counseling, whether there is a urinary problem, incontinence, prolapse, or they lack. So many people they come for lax
That's
vagina.
vagina.
So you can tighten the vagina, and
Yes.
if there is any problem, scars or dyspareunia, treat it. A deep dyspareunia, see, with painful it can be superficial dyspareunia or deep dyspareunia, or during the
Yeah.
penetration, there can be vaginismus. All these things you should be able to recognize. Do a
Yes.
proper examination and give them a proper counseling. Talk to both husband and wife before you do any hysterectomy or treatment or
Yes.
any cancer surgery, because cancer can devastate the couple's
The
relationship in a
life.
very big way,
Mm.
and many young women are getting affected.
Developing cancers
Yes,
nowadays.
yes. My recently, my one of my one husband telephoned me, asked me, it is our love marriage. 6 months after our marriage, we found detected there is cancer in my wife. But I want to give, as long as she is alive, I want to give her the best of the life. I want to give her the happiness. Can we have sexual intercourse?
Yeah.
See, these are all very important. That is a real quality
Yes,
of
very
life
sensitive
question for
issues
them.
we need to
Very
address. Very,
sensitive, as you said.
very sensitive
So,
issues.
and we should be able to talk to them. What best we can
I
do,
know.
depending on whether it is breast cancer or uterine cancer, whether the closure of the vagina, contraction of the vagina, the lack of lubrication, or the disfigurement. So all these things are really very important. If you don't talk to them about these things, then we are not doing justice to
Yes,
them. We are
yes.
not doing the proper treatment for the patients.
So, Dr. Padmini, just last question before we close the session.
Hmm.
Now we know there's a lot of confusions about gender identity, and we have LGBTQT in our society now,
Yes.
and there are a lot of them are looked down upon. People are judgmental. Of course, those times are changing. So, what about their sexuality, and how would we be of help to them in creating, giving them the proper place in society regarding their own sexuality?
Correct. So this recently there was 4th September was the
World
World
Sexual.
Sexual Health Day, and one of the thing is about this also creating awareness about LGBTQ adolescents. One of the in the theme. So that is how we have to create awareness about that, and it is a reality. It is the biological and natural. And it is not that they are having doing that voluntarily or without any reason, but they are made like that.
Yes.
Like how there is heterosexual attraction, there is also homosexual attraction. This is about sexual orientation and sexual attraction and gender identity. We have to understand gender diversity in our society. So some are made like that, and they are also part of our society.
Yeah.
And they are everyone, irrespective of your male, female, transgender, or any gender diversity, any age and any ethnicity, any part of the world, they all have sexual and reproductive rights. And one of the rights is that we have to accept their
Accepted.
sexuality as it is. And everyone has got a right to privacy, right to free from violence, and also take decision, have access to information, and they all should be looked upon. Any violence
Respectably.
against
Yes.
gender-based
Respectable.
violence should not be there.
Yes.
You have to accept. You accept all the. You have got rights for our animals and plants and
No.
other things and trees. And why don't you have the right for a human body or
Yes.
the right for the human beings? And this is the adolescent time when they're developing this attraction, sexual attraction. So they understand that whether I am attracted to the girl feels that she is attracted to the boy, or the boy feels attracted to the girl. That is a heterosexual attraction which happens in the majority of
Natural.
the time. But there are few
Similar.
children, so they detect that I am something different. I am not like my friend. Why, when they are discussing and talking about
I
this
feel
attraction
different.
to girls, I feel different. I am not getting that attraction. I get more the attraction towards the other boy, or the woman, girl gets attracted to them. So that is how when they really have got confusion about their own gender identity. So irrespective of your natal gender, whether it is male or a female, what you feel inside will be very different. A male can feel that is trapped in a female body, or a female can be trapped in a male body. So that's so at a point of time, the stress or the internal pressure becomes so much that they want to change their gender also.
Yes.
They want to
Gender
get
also.
rid of their
Yes.
appearance and
True.
get into the whatever they feel. So that is internal feeling of who you are. Whether I am feeling myself as a boy or a girl or a transgender. So that is the gender identity they have. So depending on that, the other things, gender expressions and the roles and the attraction, all these
Yeah.
things will
Will
come up.
depend.
But we have to accept, and it is a medical
Respect.
thing.
Yes.
It is a scientific thing. It is not just a voluntary, they're purposely making like that, and understand this. So then they also should have every right. They also should, violence should be avoided, and just only because of their sexual minority and the sexual orientation, they should not be given and going into the violence or the coercion,
Abuse and
force and the abuse, physical, mental torture. So all these things can. So many rules and the acts have come up, and government is helping, and people are understanding. What people have got is the phobia, the
yes.
homophobia or the
Stigma.
transphobia.
A
So what
stigma.
they will do for us and what will happen to us. So this is, and they're very good people, very talented, and so many have got, they're
Yes.
doctors, police officers, IAS officers. They're like any other human beings, except that their orientation is different. So that's how we had to accept, bring them to the mainstream of the society, and accept them as they are. So then, so this once the phobia is removed, then they should.
We live like
Because
it.
of the phobia and they are not treated and given proper respect, that is how you only look at them at the as the people who clap at the traffic signals,
Traffic signals.
prostitution, and that is how you feel. So, but once they are also given proper the respect and the
Society.
part of society, they also can
join the mainstream. They're already, many of them have already joined the mainstream.
already they are joined, and lot of things they are doing. Government is also helping. Supreme Court also has helped. So like more things need to be
Yes.
done regarding that.
Yeah.
Yes.
Thank you, Dr. Padmini. It was wonderful. You have really decoded sexuality, the medical and social perspective. I know, of course, this is a very panel, I mean, a forum which is just a little discussion, but I think each one of us have to join in decoding and creating awareness, educating, and see that all our women have a healthy sexuality, and support all those who are LGBTQ and respect them, so that they are not abused, or they do not have any stigma, or they don't have any wrong information. I think, thank you very much for being on this podcast of Gyan Pravah, and
Thank you very much.
Namaste.